I'm Dr. Norman Marcus, Director of Clinical Muscle Pain Research at Weill Cornell Medicine, and I'm going to speak about back pain, which is a mystery to most of us, clinicians and patients as well, and I'm going to suggest that muscles are the number one cause for most back pain. Studies of large populations of patients indicate that the number one diagnosis for low back pain in outpatient populations is nonspecific or idiopathic low back pain, which is defined as sprains and strains of soft tissue. Soft tissue, of course, includes muscle, as well as fascia, ligaments, and tendons. But if we just look at muscles alone, we see 320 paired and one unpaired muscle for a total of 641 muscles, which represents approximately 45% of the body weight. The next three slides identify all the specific muscles that I identify in my practice as a source of pain. It is important to know exactly which muscle is causing pain, because if your treatment involves injections into muscle, in order to get the best results, the injection should go into the ends of the muscle where most of the pain originates. Each muscle listed may be the reason that you have pain somewhere in your body. There are different explanations for how various muscles cause pain. One conceptual model is functional causes, which are based on the use and misuse of our muscles. Each of the four types would be treated differently. Tension and stress. When we're anxious, we tend to contract different muscles in our body, which may result in pain. Deconditioning. We may never exercise, or when we exercise, we may do it incorrectly. For example, only strengthening and never stretching, resulting in weakness and/or stiffness of muscles, which also may result in pain. Spasm. Sometimes a muscle may contract strongly and not be able to relax. This is called a spasm and may be associated with very significant pain. And the last is altered muscle tissue, often described as trigger points, where you can feel a tender spot or a nodule or like a band-like constriction in a muscle, and this may be the source of pain as well. We can see that this topic is large and actually somewhat complicated. But the take-home message is, remember, if you have back pain, most often it's coming from muscle.